I'm going to go straight on to Don next. Don O'Neill is a disabled activist and he's an author. He wrote the book, The Lack of Care Act 2014, and he's going to talk about his own experience and that of many disabled people he's spoken with, and also hopefully some pointers for the future. So welcome, Don.
Thanks, Tony. Hi, everyone. I want to tell you about Esther. In her late 60s, had polio as a child and needs a new kidney, and she needs 24-hour care. Now, Esther's care package is delivered by living carers, and everything was going well up to about 2018. She was funded £850 a week for her care package, and with that she could have living carers all the time. And then one day a social worker came round and said, "Oh, we're going to review your care." And after the review, they said, "Well, you don't need night care anymore. We're going to cut your care from £850 a week to £430 a week." And she said that the social worker said, "At night, what you can do now is just wear a pad." Now, even though Esther's care at night involved more than the toilet, it involved testing her blood because she had diabetes and many other things. That's what happened to her. And so, problem is, Esther had no idea how to challenge this. She had no idea who to turn to, no idea of her rights. And so even with great new laws, they're all very well telling people what their rights are, but she didn't really have the confidence to challenge it either. And so she had no idea what to do. Luckily, and this isn't about me, it's about her, she lived next door to me, and she told me what happened. And I got a lawyer for her. And after a battle with the local authority for about 8 to 12 months, not only did they reinstate her level of funding, they increased it. Now, the problem is, Esther's story is repeated all around the country, and not everyone has a friend next door or someone who knows the system to actually help them get the care they need. Because many people don't get the care they need simply because they just don't know how to ask for it, or that they don't get enough care because the social worker pops around and says, "Oh, we're going to cut this, cut that," and they don't have the confidence to ask for it as well. One thing I think every local authority ought to do is have a user-led organisation of adult social care users. And there are 3 main reasons. The first one is advocacy. As I said, it's all very well giving people rights and telling them their rights, unless they have someone to help them fight for those rights, they're quite pointless. And also when it comes to assessments, many people lose out on their care because the assessment's one-to-one in their home, there's no one else around, and they get intimidated or scared by the social worker. But if they had advocacy from someone who knew the system, they could not only keep the care they have, but also increase the amount of care they get. Another reason why we need user-led organisations is that local authorities often run care badly. They bring in a new initiative, which where I live in Oxford, they brought in the new Oxfordshire Way. And service users, you look at this new initiative and you think, what the hell's that? How much money did that waste? And I know local authorities need more money, but they also need to spend the money they have far better. And I think if user-led organisations were involved on a day-to-day basis, helping them create new services where they run, and also helping them to find out what's actually needed, they could create services that people actually want, and they could create them at a cost that doesn't actually cost as much as it actually does now. And another reason why we need a local user-led organisation is to help people manage their care. Many people can't find carers. They have no idea how to find a carer. And again, under the new Care Act 2014, that kind of information should be given to people. But even if it's given to some people, they have no idea how to use that. A friend of mine, her carer was going to go away for 4 weeks, and she had no idea how to find a carer. And because of that, she just went without care for 4 weeks. But if there was a local group who could help her, she would have got that care and all would have been okay. So I do feel that new laws are great, new rights are great, but people need lots of support to actually get the care that they actually need. And also we do need to have better services run far better by people who know what's needed and how it should be done as well. And I do feel that having a national care system, which is publicly owned, that would really, really help. A lot of times, for every pound local authorities spend with care agencies or other private firms, as Prem said, 40% or even more sometimes is not going towards care, it's going towards their business overheads or their profit. And so this is why I joined this campaign to end the social care disgrace and to get free care run by the public